Welcome to Section 2 of Dermatology in General Practice, Allergic Skin Disease. In the next 15 minutes, you will learn what allergic skin disease is and what the role of the skin barrier is in allergies and the prevalence of allergic skin disease in practice. You will also learn common clinical signs and how you can diagnose allergic skin disease. Can you imagine what would happen if the skin barrier is not functioning properly? You would see an impaired physical barrier to protect against injury, foreign substances, and pathogens. You would see impaired water retention and impaired lipid properties. You would see impaired natural antimicrobial properties and altered immune responses. Remember that an allergic response is an altered immune response. An allergic response is defined as a hypersensitive immune reaction to a substance that normally is harmless and would not cause an immune response. Here's a diagram of an allergic reaction or a hypersensitive inflammatory response, from the initial allergen exposure to the IgE production, the histamine-producing mast cell, IgE-bound mast cell, and allergen re-exposure, which all leads to an itchy pet. How does that hypersensitivity allergic response look in real time during an allergic skin test? Thanks to histamine, you see redness, edema, and it will be itchy. Some allergic response pathways will be different from the classic type 1 hypersensitivity response. We are still learning all the complexities. What is the inside out versus outside in theory? Inside out and outside in helps one consider the reason for skin damage in allergic patients. The inside out theory of allergy is that an altered immune system and resultant inflammatory response does secondary damage to the skin barrier. The outside in theory shows an impaired epidermis leads to an increased allergen penetration, resulting in a higher allergen exposure to the epidermal immune cells. Really, it's a two-way street. Skin barrier function is worsened by inflammation. The worse the skin barrier damage, the more propensity exists towards skin dysbiosis and allergic sensitization. Deep skin barrier disruption is a more extreme scenario of outside-in exposure. Exposure to allergens deep within the dermis means interaction with immune cells and entrance into the lymphatics and circulation. Immune response may be tolerant or inflammatory, an allergy. Evidence for skin barrier dysfunction exists. In people with allergic skin disease, there are numerous changes in the skin barrier. There is increasing evidence that skin barrier defects exist in dogs with allergic skin disease. Early studies have shown abnormal intracellular lipid, increased loss of water, abnormal epidermis, and a reduced overall concentration of skin ceramides. What part of your practice is made up by itchy patients? That's right, it's a big piece of the pie. Allergic skin disease dominates small animal practice. It is not uncommon for dogs and cats to have multiple allergies that will make them itchy. The secondary skin infections from scratching will perpetuate the itch. Pets can be allergic to insect bites, airborne proteins, or foods. Let's look at the prevalence of disease. Skin conditions and concerns are one of the most common reasons for presentation to a veterinary practice. Studies indicate that between 6 and 15% of feline patients have at least one dermatopathy, and many cats suffer from more than one. Different studies report between 10 and 15% of the canine population has allergic skin disease. Atopic dermatitis is the second most common cause of pruritus, behind flea allergy dermatitis worldwide. This is different in Canada. Atopic dermatitis is the most common cause of pruritus in Canada. It is 2 to 3 times more common than flea allergy dermatitis. The primary allergy categories are food and environmental. A food allergy or sensitivity is an abnormal response by the immune system to a dietary ingredient. It is often a protein source. This is referred to as a cutaneous adverse reaction to food. An environmental allergy is a sensitivity to something found in the environment. Genetics play a role. This is referred to as atopic dermatitis. The primary symptom exhibited by an allergic patient is pruritus, which can include overgrooming. Is it black or white? Do you either have food allergies or environmental allergies? Well, truly, it is more common for a pet to have allergies to both food and the environment. However, food allergy alone represents 10 to 20% of allergic patients. There are some common clinical signs in dogs in response to allergies. You will often see issues with the ears, whether there will be a waxy discharge, redness, or odor, and you'll have owners report that dogs are scratching or rubbing their ears with paws or against furniture. We often see changes in the face. We might see changes in the appearance where the muzzle, chin, and areas around the eyes are reddened and have hair loss. Again, you may have an owner report scratching or rubbing their face with their paws or against furniture. We can see changes in the skin. We can see reddened skin, possibly with crusts or scales, odor with secondary infections, and again, scratching, licking at the sides, belly, elbows, and groin. You may see changes in the hair coat. There may be bald spots or brown discoloration where the pet has been licking. Changes in behavior will include scratching, sides and belly, rubbing the face against the furniture or carpet, and excessive licking. We often see changes in the feet. We'll see inflammation, redness, odor, brown discoloration where that animal has been licking, and that's the common behavior, licking and chewing of feet and pads. So ears, scratching, feet, these are the common symptoms that owners will report. Ears, rears, and feet are where we look first to decide if this is an adverse reaction to food. Remember, we do see GI upset in up to 32% of food allergic patients. Chronic ear infections may be the only sign. We commonly see chewing and licking of feet, chewing and licking the anus or scooting. When pets with GI upset, we can see vomiting, increased frequency of defecation, flatulence, soft stool, or diarrhea. We may only see something like borborygmus, increased gut noises. Might see burping or halitosis, different than common allergic symptoms in cats. In cats, we typically see scratching at the head or neck, an itchy back or base of tail. This is more common with flea allergies, itchy ears or recurrent ear infections, and excessive scratching, licking, or chewing of the fur. We can see redness and swelling of the skin, loss of fur, scabby, scaly, or flaky skin. We could also see swellings or bumps on the skin. So here's a question that we can't seem to find Google help for. Can cats with allergic-based skin disease have non-skin clinical signs? Yes, non-skin associated allergic symptoms are possible. This might be sneezing, coughing, conjunctivitis, diarrhea, or vomiting. The eosinophilic granuloma complex can be another manifestation of allergy in cats. This may be something you've seen in your own practice. Determining the cause starts with a thorough case history. Many different allergic skin diseases present with very similar symptoms. Take a thorough patient history with respect to age at onset, seasonality, previous therapy, recurrent bacterial or yeast infections. Take a comprehensive food history. This includes everything that might pass the lips of that patient. So that's treats, supplements, monthly medication, table food, or perhaps a housemate's food. Is this a dog or cat that likes to get up on the table and help themselves? Is there somebody in the household who might be sneaking food to this pet? Is there a travel history? Being in different geographic areas can impact the history of the medical history of your patient. A complete change in geographical location can mean brand new environmental allergens or risk of infectious organisms. In the physical exam, you'll want to do a very detailed exam. Pattern distribution can be very helpful in determining the root cause. The skin can be a sentinel for underlying metabolic or hormonal diseases. The underlying cause of the itch may not be discovered despite a thorough examination. A stepwise approach is needed. Allergy testing is investigated near the end of a thorough dermatology evaluation. What about these little guys? First, rule out any ectoparasites. Before performing diagnostic tests for allergic skin disease or pursuing therapy, always be sure to rule out other causes of pruritus, such as ectoparasites. Diagnostic tests should include cytology, skin scrapings, flea combing, parasitical trials, and potentially a fungal culture, pending clinical signs. Can you guess the unique challenge with cats? What fastidious pastime do they take part in? Cats love to groom. Finding ectoparasites on scrapings may present a challenge. Consider scraping regions that cats cannot easily access, such as between the shoulder blades. Consider performing a fecal examination for ectoparasites. Regardless of a lack of positive identification of ectoparasites on dermatologic or fecal examination, aggressive antiparasiticides for lice, fleas, and mites are an essential part of a diagnostic and therapeutic approach to any itchy cat. If minimal or no response is noted, then consider environmental or food allergies as one of your primary underlying etiologies. Let's look at an allergic patient dermatology visit checklist. Treat, rule out any secondary bacterial or yeast infections. Rule out ringworm. Rule out concurrent metabolic diseases with appropriate blood tests. Flea prevention for a minimum of 8 weeks, which includes all other household pets. Diet elimination trial of 8 to 12 weeks. Monitoring by the pet owner for improved patient comfort with scheduled rechecks. Skin biopsy will usually not add information with regard to the cause of allergic dermatitis, but can be useful in non or minimally responsive cases to rule out other differential diagnoses. Allergy testing via serum or intradermal or combined. What else is at the heart of a dermatology workup? Fostering that human-animal bond by keeping patients comfortable. Providing patient comfort is essential. With the advent of safe and effective medications such as Atopica, Apoquel, and Cytopoint, exposure to glucocorticoids can be minimized during the dermatology workup for the canine patient. In feline patients, symptomatic treatment of pruritus with glucocorticoids or cyclosporin is usually helpful in providing patient comfort. New opportunities for dogs and cats exist. There has been a really exciting antennal alopecia clinical trial. 31 dogs divided into 3 groups: mild, moderate, and severe allergic skin disease. We saw improvement in skin and coat condition in 75% of the dogs in the mild group, 33% in the moderate group, and 50% in the severe group. Decrease in pruritus in 55% of the mild, 44% of the moderate, and 40% of the severe. And improvement in lesions in 91% of the mild group, 33% of the moderate, and 40% of the severe group. We have more 15-minute takeaways coming up next with part 3, one of the most common causes of itch, atopic skin disease. So grab another coffee and join us again. Thanks for your attention today.